Heart rate can be taken at the radial or carotid arteries. We'll be finding heart rate at the radial artery, which is located at the lateral aspect of the palm side of the wrist, in line with the base of the thumb. Robin will apply gentle pressure with the tip of her middle and index fingers, not her thumb, because your thumb has its own pulse. Robin will count Gilbert's pulse for 15 seconds, remembering that the first beat counts as 0. To get beats per minute, Robin will multiply the number of beats by 4. A normal heart rate for adults is 60 to 100 beats per minute. Lower resting heart rate usually indicates a heart conditioned by exercise training.
The resting heart rate is then classified by age and gender. To measure resting blood pressure, make sure the client has had no caffeine or nicotine for at least 30 minutes. Also, make sure the client's been sitting for at least 5 minutes with the back supported. Double check to make sure that their legs are not crossed and they're flat on the floor. Their arms should be in a support at heart level. Place the cuff 1 inch above the crease at the elbow. Do a 2-finger check to make sure the cuff is tight enough but also has enough room. Client's elbow should be fully supported and slightly flexed. Place the stethoscope head flat over the brachial artery on the medial to the bicep tendon. Quickly inflate the cuff to 200 millimeters mercury. Release pressure valve at a rate of 2 to 5 millimeters mercury per second. Systolic blood pressure is the first initial sound you should hear, and it's clear and repetitive. The diastolic is a complete disappearance of sound. Listen for another 10 millimeters mercury below the diastolic blood pressure to make sure you have correctly identified the diastolic. Deflate cuff rapidly to 0 and wait 1 minute in between readings. After taking at least 2 readings, you would then classify your patient accordingly.
For exercise heart rate, again, the patient's heart rate will be taken at the radial artery on the left side. Gilbert will apply gentle pressure with the tip of his middle and index fingers, not the thumb, and will count the pulse for 15 seconds, still remembering that the first beat counts as 0, and multiply the number of beats by 4. Heart rate is taken during exercise to look for appropriate cardiovascular responses, as well as to indicate at what intensity the person is working out at.
Now we will demonstrate how to take blood pressure during exercise. Again, prior to beginning the exercise, ensure the cuff is placed 1 inch above the crease of the elbow and properly secured. Ensure you use the same arm as you did with resting blood pressure. Ensure the client's elbow is fully supported and slightly flexed prior to taking the blood pressure. You will then place the stethoscope head flat over the brachial artery and medial to the bicep tendon. Earpieces to the stethoscope should face forward towards the nose, same direction of the ear canal. Quickly inflate the cuff to 200 millimeters Hg. Release the pressure valve at a rate of 2 to 5 millimeters Hg per second. Systolic blood pressure is going to be the first initial sound you hear. It should sound like repetitive padding. Diastolic pressure will be measured at the complete disappearance of sound. Once diastolic has been measured, quickly deflate the cuff rapidly to 0.